It's worse than we thought, and we have only one job to do. This is Bloomberg Wall Street Week. I'm David Westin. Welcome back. Another week and another week of the coronavirus as the infections mount and the death toll rises. Wherever we are in the United States or around the world, whoever we are, and whatever political affiliations or beliefs we might have, we now only have one common enemy, and that is defeating this coronavirus. And for the United States, President Trump has designated his vice president, Mike Pence, to be his general in charge. And so we start this week with Vice President Mike Pence and what he would say to the millions of Americans who are losing their jobs.
Well, I want to tell the American people that help is on the way. Thanks to the President's leadership and strong bipartisan support in the House and Senate, we passed a historic relief bill that will soon be speeding aid to American families. The average family of four will receive a direct payment of $3,400. There are going to be loans which will operate as grants, essentially, for small businesses to support payroll. During the course of the coronavirus epidemic, businesses the small businesses around America would be able to keep people on their payroll during that period of time. We're going to be supporting our major industries around the country. And we'll get through this. We've supported unemployment insurance benefits for the states. We're working closely with governors to make sure that those that are impacted have the support to see their family, to see their businesses, and to see their communities through the course of the coronavirus. And we really do believe that as Americans put into practice the President's coronavirus guidelines, 30 days to slow the spread, that will every single day be one day closer to putting the coronavirus behind us. Our priority is health. Our priority is the health and well-being and the lives of the American people, supporting our incredible healthcare workers. The President has every confidence that as we help people through this time, that the economy will come back stronger than ever before. But we'll stay focused on defeating this virus and giving the American people and our healthcare workers the tools to do just that.
Let's turn to that battle against what the president has called that invisible enemy, that is the coronavirus. Bloomberg reported earlier this week that there's classified intelligence information that China actually sat on the information about how bad it was. If you had known when China did how bad it was, would it have made our battle plan against this enemy different? How many American lives might have been saved?
Well, there's no question that had China been more forthcoming than they have been about the impact and the scope and the nature of the coronavirus, not just to the United States but to the world, that it would have made a difference. That being said, we did have a team on the ground in February. We were able to look at their data. We drew conclusions from that, and I have to tell you, I think, when the very first coronavirus case emerged in this country, someone who had been in China and contracted it there, in a matter of days, the president stood up the White House Coronavirus Task Force, suspended all travel from China. From there, would issue travel advisories for South Korea and portions of Italy. We began screening 100% of all passengers from both of those countries, going on to suspend travel from Europe, the UK, Ireland. I think all along the way, the American people have seen that this president has been willing to take decisive and at times, David, unprecedented action to put the health of America first. And we are continuing to bring not only a whole of government approach at every level, federal, state, and local, but also a whole of America approach. We're seeing American businesses step forward as never before to meet this moment, and that's where we'll keep our focus. And I truly do believe that as every American does their part, whether they're in an area impacted by the coronavirus significantly yet or not, if they do their part to heed state and local authorities, if they do their part to engage in the social distancing and the mitigation efforts the president has advised for every American. We will put the coronavirus in the past, and we will save lives, and we'll bring our nation back.
Mr. Vice President, I don't think there's anyone who questions that the president and you, the entire team of the White House, is doing everything you can at this point to try to stop this. At the same time, to some extent, it appears we've been playing from behind. The virus has been ahead of us. Do we have enough testing capability right now to get ahead of the virus? I'm talking about not the hotspots of New York, for example, or Detroit, increasingly New Orleans. Do you know what are likely to be the next hotspots?
Well, what I can tell you, David, is that because of the public-private partnership we forged with these vast commercial labs that your listeners know well, LabCorp, Quest, others, companies like Roche, we're now testing over 100,000 Americans a day. But a very significant breakthrough happened this weekend. Again, moving with record speed, the FDA approved Abbott Laboratories point-of-care test. It literally is a 15-minute test that people can have administered at their local doctor's office. We're in the process of identifying the thousands of Abbott Laboratory machines that are around the country. We're making sure that we're distributing those not just to areas that are seeing an impact today, but we want to distribute those as Abbott Laboratories making about 50,000 tests a day now. We want to distribute those to areas where we can do what you had implied is the kind of surveillance testing that would allow states that currently don't have a significant outbreak to be forewarned and forearmed and to be able to do the kind of contact tracing that would limit the exposure and the spread of the coronavirus. But the last point is, in answer to the other part of your question, we literally are tracking every single day the number of cases that are coming out, where they're coming out. I've already received a briefing this morning of county by county, state by state analysis, and that's informing our coordination not only with the Strategic National Stockpile, FEMA, but with healthcare distributors around the country about where we are sourcing and focusing everything from personal protective equipment to all the supplies that our healthcare workers need. We're focusing it where the outbreaks are. We're working closely with governors to support their requests, whether it be for personal protective equipment or field hospitals, and we'll continue to do that around the clock.
Vice President Mike Pence. We look for some glimmers of hope in a possible vaccine that would cure us of this disease. So we talked this week to former HHS Secretary Kathleen Sebelius and to Johnson & CEO Alex Gorsky, who thinks he may have a promising contender.
We expect to be in a position by the first quarter to have a much better perspective on the vaccine itself, on the kind of quantities that we would have available. Our goal is to have hundreds of millions available by that time.
This is Wall Street Week. This is Wall Street Week on Bloomberg. I'm David Westin. Johnson & Johnson announced this week that it has a promising candidate for a possible vaccine for the coronavirus, one that could be in field trials as early as September, and in success, if they have success, they could have available for the public as early as the second quarter of next year. I talked with Johnson & Johnson CEO Alex Gorsky, and I asked him just how hopeful we should be.
We're very hopeful as we look at our early data that in these cases tends to be, quite correlated with what we would expect to see as we take this into human testing in September of this year. But we also know we need to complete those other trials, and we'll be doing that. At the same time, we're going to be ramping up our production, and we'll have global production. We expect to have that both in Europe as well as the United States. And we expect to be in a position by the first quarter to have a much better perspective on the vaccine itself, on the kind of quantities that we would have available. Our goal is to have hundreds of millions available by that time. And then obviously to work with regulators and other people around the world, depending on where the coronavirus is at that time, to try to make this accessible on an emergency basis.
Alex, give us a sense of what that testing process is. Is it the normal testing process you'd have for another vaccine, or given the urgency and the size of this problem, are there certain things that can be done to expedite that?
Well, David, look, my sense is that regulators, both in Europe and the United States, let alone around the world, other healthcare authorities and the government are doing everything they can to expedite this. At the same time, we have to balance that to make sure that we gather the efficacy, the safety data that's so important before, of course, we would be using this on a large scale. Now, in this particular case, we're working with a platform. So think of it as a vaccine, part of a vaccine, where we've got significant experience in areas like SARS, things like Ebola, things like HIV. And so we are confident in the safety data that we've seen thus far. And it's already, the vector's been used in elderly, it's been used in younger children. So that gives us confidence from a safety perspective. The early testing that we've done so far, that includes a range of animal as well as in vivo testing, also indicates that we should have an active vaccine as well. But of course, we need to complete the trials that we'll be doing in humans in the fourth quarter, before we develop the final data set, that would help us make that decision at the appropriate moment.
So to push ahead and push perhaps farther than we should, if you were successful in the fourth quarter, when would we have a vaccine available to people?
So, David, look, what we would intend to do, again, work closely with regulators so that by late December or early January, we would expect to have some type of interim analysis in our first-in-human trials. And then at that point, we would have to take a look at that data set in its totality. I think clearly we would be also looking at how is the virus proceeding and what kind of state is it in around the world, and then make a decision. So I think at some point in the second quarter, we could be in a position, again, on an emergency basis, depending on where the pandemic is going, where there could be some access to this, and then we would expect that to ramp up significantly over the rest of the year.
Give us a sense, because I know you're committing a lot of funds to production, not just the development of vaccine, but in success to be able to produce a lot of it. How big could you get? How soon, if in fact it does work?
Well, you're right, David. To have a vaccine to really work effectively, it takes two components at least. I mean, first of all, it's demonstrating efficacy and safety of your vaccine. And that's what we're working very hard on, literally as we speak. But also, as I said, some of our trials will start in September in human. We'll have some additional data by December. But you also need to produce them in sufficient volumes and quantity so that you can actually make a difference in the broader population. And we're very fortunate in that we have a very unique production capability where it gives us the ability in relatively small containers to make very large volumes in the hundreds of millions of doses of this vaccine. Now, again, let me be clear. We still have more work to do to determine the exact yield of these particular technologies and to compare that versus the safety and efficacy data. But based upon the original work that we've done, again, we feel quite confident that we can be in the range of hundreds of millions of vaccines as we would move into the early part of 2001 with a goal to have 1 billion in place by the end of the year.
That was Alex Gorsky, Johnson & Johnson CEO. Finding a solution to the coronavirus requires a partnership between the government and the private sector. And so we asked the former HHS Secretary Kathleen Sebelius how the government is doing so far.
BARDA is a little known but very, very important entity within HHS. The name stands for the Biomedical Advanced Research and Development Authority, and it's within the Office of Emergency Preparedness and Response that has a broad coordination for, as it says, responding to emergencies, natural and man-made and pathogens and biological attacks. So BARDA is an entity that is directed to coordinate 3 very important HHS agencies, the National Institutes of Health, and people have gotten very familiar with Tony Fauci, who leads the institute designed for vaccine development, the Food and Drug Administration that has the regulatory agency within HHS that has the responsibility of actually making sure that medicines are safe, effective, they do the clinical trials, and they eventually give the okay to distributing any kind of medication to the public, and the Centers for Disease Control, that is really the public health backbone of the United States Health Department. They're the epidemiologists. They track, surveil, and mitigate situations. So BARDA has a coordination responsibility, and they really are charged with getting as quickly as possible safe and effective medical countermeasures prepared, sometimes just to put in the stockpile. They do a lot of analysis of what may be coming down the road, of what we're seeing, of what we may need. But in this case, they would be the agency charged with, if you will, taking down, all the barriers, making sure agencies are talking to each other and coordinating the fastest possible federal response.
Yeah, fast as possible. That's what I was going to ask about, because in talking to Alex Gorsky, the CEO of Johnson Johnson yesterday, he said they hope to have field trials started in September. And if that happens, and in success, we don't know it'll work, but they think it's promising, then they'd have a vaccine perhaps in the second quarter of next year. Is there any way to compress that without running undue risk or concern?
Probably not. Unfortunately, we're in a situation, there is no coronavirus vaccine. So when I was secretary, we had the H1N1 outbreak, a flu strain that hadn't been seen since 1918. But the good news on the vaccine side was that there were flu vaccines. Every year, scientists projected what was the likely flu strain and tweaked the annual vaccine. So we could actually kind of tag onto that process and develop a much faster vaccination. This really starts from scratch.
That was Kathleen Sebelius, former Secretary of HHS. Coming up on Wall Street Week, the coronavirus has changed our world in many ways we can't imagine. But David Cordani, the CEO of Cigna, thinks he does know one way.
Individuals are more open to experiencing care virtually today than ever before because of COVID-19.
This is Wall Street Week. Welcome back to Wall Street Week. I'm David Westin. The coronavirus has changed our world in all sorts of ways we really don't understand. But David Cordani, he's the CEO of Cigna, thinks he does know one way it's changed, and that is the advent of telemedicine, which has gone up dramatically, and he thinks will not go away.
Even before COVID-19, we as a company were stepping forward saying we wanted to expand what we call the front end of care and bring more care and more services to individuals. So in three different ways. One is telemedicine, both medical as well as behavioral health services. Second is to attempt to re-envision what could take place in the home in terms of expanding what could take place in the home. And then third is working with our physician partners to expand the services that could take place in a less invasive setting, more specifically in a physician's office as opposed to an outpatient facility or the like. So point is, we've been ramping toward an expansion of virtual care and in-home care in advance of COVID-19. Now, to your core of your question, individuals are more open to experiencing care virtually today than ever before because of COVID-19. And we're seeing the volumes ramp in quantums, multiples of what they were ramping at in advance for both medical health as well as behavioral health. And that's what led us to redeploy resources that we have, nurses and doctors, to partners like MD Live and others to expand that reach. And we think this will be a societal change that probably will continue to go forward long after COVID-19 because it's a convenient, safe, effective, evidence-based way to consume many aspects of care.
David, we're all focused, of course, on COVID-19 and the disease that is spreading across the country. But I know, because you and I have talked about it before, you're also concerned about what you call whole person health. Right now, there's a lot of strain being put on that because we all are in remote locations with our families or even alone. How are you addressing that issue?
Yeah, so David, I appreciate the whole person health. That is our orientation around trying to connect the mental health and physical health aspects. And just as a backdrop for your audience, we know today in the United States, as an example, if an individual has a chronic disease, of which about half of Americans confront at least one chronic disease, you're 7 times more likely to have clinical depression than if you don't have a chronic disease. But if that clinical depression goes untreated, you're more likely to have follow-on onset of additional medical or behavioral conditions from that standpoint. So we bring the behavioral health resources into our chronic or case management system from that standpoint. In the current environment, it's going to get strained even further because there's separation that is taking place, to your point, and we know that separation increases loneliness, and loneliness increases mental health challenges. So we're expanding and trying to press ourselves relative to, as we talked about, telemedicine for behavioral health, but also inbound interactions to our customers or patients from our nurses, from our behavioral health professionals, from our health coaches, to try to elevate and broaden the levels of engagement, especially during this unique time. So I think it presses the importance of engagement up even further, and it presses the importance of whole person health even further, and we need to be creative in terms of how we step up to it in this interim period of time.
David, Cigna is an integral part of the overall healthcare system in this country. Give us some sense of just how much stress and strain is being put on that system. Is it up to the task? What does it need?
Well, the U.S. healthcare system's quite sophisticated and multidimensional, and as an American, I feel fortunate to have access to that for myself and my family. No doubt it's under strain because it's imbalanced at this point in time. So when you take dimensions of the sophisticated surgical interventions we have around musculoskeletal or otherwise, many of those services are being deferred at this point in time because of the importance of the acute inpatient services. A concrete example, we and others in our industry step forward in consultation with hospitals to try to change and accelerate protocols to help to get individuals who are non-COVID-19 patients who could be transferred out of hospitals into long-term care centers, skilled nursing facilities, or even coordinated services at home. That takes some pressure off of the delivery system, the acute delivery system, and creates more capacity for the needs of COVID-19 patients. Lastly, as we're seeing, there's an imbalance taking place, not just in terms of the acute healthcare system, but also around the country. So as the waves move through the country, we have the opportunity for learning to take place as best practices are happening from some of the initial hotspots like the Pacific Northwest or now Greater New York for other locales to learn in advance and be more prepared from that standpoint. So quite sophisticated. People are pulling together in cross-industry ways I've not seen before in my career, but it is under strain, and we need to be supportive of our healthcare professionals accordingly.
That was David Cordani of Cigna. Coming up on Wall Street Week, Brian Moynihan of Bank of America gives us his view on what's coming up for the U.S. economy.
There'll be a deeper downdraft, but most economists that I see and our internal economists believe on the other side is a reversion back to where the economy almost gets back to the same size, at sometime in next year that it was prior to this, which is a pretty fast turnaround.
This is Wall Street Week. This is Wall Street Week on Bloomberg. I'm David Westin. There's no question but that we're all facing an economic crisis, the likes of which we've never seen. And Bank of America is right in the center of that economic crisis. But when I talked with the chairman and CEO, Brian Moynihan, he said we have to start with a health crisis before we move on to the economics.
As we went through January and February, we saw with our consumers spending money at a much faster rate, a double-digit rate versus 2019. So the economy is probably going to grow faster than people projected would have been my guess. Then as you went into March and you saw the situation, even with the impact that happened in March, especially in the latter half of March, we'll still see our consumer spending in the aggregate in March, and this has cost $3 trillion in a year, so it's not a small sample, be up for March. Not a lot, but 2 or 3%, something like that. And year to date, it'll be up almost double, high single digits. That is faster than last year versus the year before. So the economy is on this path. It just, as you watch March play out, has changed dramatically. So What the Federal Reserve did is start to do a lot of liquidity programs to stabilize the markets. What Congress passed with its stimulus bill is an effort to keep people employed. And so, number one, at Bank of America, we've told our teammates they have a job to year end, which is important, and many other employers have told that. So that to the extent we keep people employed, keep cash into the household, that'll be terrific, and keep a baseline economy growing. The other question is, how do you help small businesses do that? And that's the program that's been announced that they're going to implement beginning Friday. The key to that is to how do we get that money out quickly as the bank industry on behalf of Congress and the president and the administration. And, they developed a set of regulations. They are coming out, and they're out in process, and they've been published, or they're starting to publish them. We just ask customers to be patient. My advice to customers is go back to their banking, who they already have a lending relationship with, because the kind of documentation is the kind of documentation you work with those banks. We'll have millions of customers come to us, and we'll put them through, if they desire, into the program, and it'll be very good because they can continue to pay their employees. That's what the money's geared to do, and also cover some overhead, both of which are good things to help these small businesses through this tough time. And we'll do, we're setting up shop and activating thousands of people to be able to take the applications, a huge digital presence, and I think if everybody can just do it in an orderly fashion, it'll be very good for the U.S. economy.
In order to get the money out the door, which is what the small business needs so badly, because they often don't have the money to keep their employees on payroll, are you willing to take something of a leap of faith? Are other banks willing to take a leap of faith? Because you're going to have applications that normally maybe you wouldn't give a loan against, but now the government's saying, well, that'll turn into a grant if they keep their employees. Does that work? Do you have enough faith that you'll actually deploy a lot of cash that way?
Oh, yeah. For the clients, it's a straightforward set of needed documents that they have to supply, and if they supply those documents, they can get a loan and a calculated amount based on the people they pay in the first couple months of the year, and then they can have it forgiven if they continue to people employed after that. And so for this particular element, it's government guaranteed, so it's a government program, and all we are as its banking system, my peer colleagues and stuff, is an implementer of our progress. And let me go to the other side, just so you know, because the strength of our banking system and the capabilities and the capital we've had and built up in the processes, the industry, one of our trade groups announced today, BPI, that the industry had funded more than $400 billion in commercial loans, most of that in the month of March. Bank of America has done $70 billion of loans, commercial loans, in this month. Still have way more than our required amount of capital, earn money, et cetera. So it's a pretty interesting thing that the banking industry has been able to step up because of its strength and supply to the SME businesses and even large businesses the capital, while the government's coming in and helping the small businesses, which are the hardest to get the money to.
In 2008, 2009, the banks were in constant communication with government authorities, whether it was the Fed, whether it was the Treasury, or others. Is that going on now? What sort of communications are you having back and forth with the federal government?
Well, it depends on the issue, but obviously in terms of the SBA and Treasury program, they sought our opinions of how to make sure they could get the money out in an orderly fashion, the right way, and carry out Congress's intent and the administration's intent, and so we're heavily involved in that. On some of the liquidity and how the markets are working, my colleague Tom Montag and his team are talking to all different parts of the architecture, whether it's the Fed or the Treasury, to talk about what's going on in the markets on a given day and where liquidity is needed or where action is needed. And obviously the Fed is talking to us from what are we seeing in the markets, and so the OCC and other regulators, what are you seeing from clients? What are you hearing out there? Because you want an instant transmission mechanism, because a lot of the data people look at is lagging just by definition. It has to be put together and reported.
All of us, in our own ways, are trying to live day to day, week to week, and get through this crisis. But I would like to look forward just a little bit. Some economists are talking about now the possibility of demand destruction, being permanent reduction in consumption because of this crisis. As you look at it, is there a risk of that? How large a risk is there?
At the end of the day, one of the things that is great is if you think about the throughput of the U.S. economy, with the amount of stimulus, the amount of fiscal support that's coming, the amount of monetary support, if you look at economists with their 25% down in the second quarter and then working their way out, the sheer amount of dollars in that at a $5 trillion quarterly economy, $20 trillion a year, is overwhelmed by the amount of support coming in the markets. all that is geared to getting us out the other side of this faster. There was no structural issues in the economy. It's a healthcare crisis, and I think if we mitigate that healthcare crisis, you will see on the other side of this, a rebound, and that's what our economists say. So as people have adjusted their second quarter down more due to the unemployment, the new claims last week, what people are guessing will happen this week, there'll be a deeper downdraft, but most of the economists that I see and our internal economists believe on the other side is a reversion back to where the economy almost gets back to the same size, at sometime in next year that it was prior to this, which is a pretty fast turnaround. And so, I think that's the core belief, because you're not changing anything fundamentally about the business cycle, about what's going on. You're saying if you get by this virus, it works. If you look at China right now, you're seeing the data get stronger. And because in the fact they're on the other side of this situation, and you're seeing, we're seeing when I talk to our commercial clients, that their factories that they work with is 65, 70, 75% up. We're seeing goods and ship coming out of China, and you're seeing those factories start up, and even in some of the places that were most affected, you're seeing people go out and shop. So the question between us and that is going to be when the consumer feels comfortable going out and going to a restaurant and going to shop at a store and do things like that. That will come when the healthcare crisis is solved, and that obviously there's tremendously talented people and a great healthcare system, the best in the world, working on that every day. And when that happens, whatever time that is, that's when the behavior will revert back, and it's just a matter of how fast we can get there.
That was Brian Moynihan, Chairman and CEO of Bank of America. Coming up on Wall Street Week, we talk with Afsaneh BEschloss of RockCreek Partners about another tumultuous week in the markets, and particularly for oil.
The 20 to 30, 35 seems to be where it might be sort of the new norm for oil prices.
That's next. This is Bloomberg. This is Wall Street Week. I'm David Westin. We ended a quarter this week, and it was a very difficult quarter for equities, and for that matter, for oil as well. But then at the end of the week, after the quarter was over, oil came back, and it brought equities with it. We talked with Afsaneh BEschloss, who founded the RockCreek Group after a distinguished career at the World Bank and at Carlyle. And we asked Afsaneh what is going on with the oil market.
David, it's not clear that the agreement is as clear-cut as the markets have taken it. It's not clear that the Russians have actually agreed to what we heard in the tweets. And also not clear that this quick sugar high that the markets got on the energy side, which was close to 10% on the energy sector, while the total market went up around 2%, is something that will stay up for a long time.
So what would it take, in your judgment, for the Russians actually to agree to something like this? Because there are other issues, for example, the United States has with Russia, such as some of those sanctions over the Nord Stream pipeline.
Absolutely. You have the political issues, which are ongoing and have not been resolved. On the other side is the economic issues. For the Russians and the Saudis, oil revenues constitute the largest share of their economies. So cutting back is not so straightforward at a time when they're having a lot of difficulties meeting their own situations and the expenses that are going up at a time when their own economies have slowed down. So Saudi Arabia, for example, close to 90% of its economy and revenues is coming from oil, and obviously Russia is very much based on commodities in terms of its economy. So it will be a lot of hardship for them to cut down 10 million. I also heard the number 15 million thrown around. And, if you remember when we had the refinery attacks in Saudi Arabia, oil prices did go up like we experienced today. But at the same time, they did not stay up for very long. And my belief is that while we have this quick uptick in oil prices, with the kind of demand in the economy that continues to weaken in the U.S., and even though China is up somewhat, even in China, nobody's really buying the goods that China is producing. You're not going to see a lot of sustained strength in energy markets, plus everything else that's going on, which is the storage capacities are getting filled up, and they will be pretty much filled by June. So by and large, I think oil will be more in the 30s than in the 40s to 50s, which is where people have been trying to push it to. It may even, with economy staying much weaker than people expect today, stay closer to the $20 range. But the 20 to 30, 35 seems to be where it might be sort of the new norm for oil prices.
Afsaneh, going beyond the energy sector, let's talk more generally about investing right now. You're responsible for investing, and you like to do it based on data. But are there data you can really rely on right now? Obviously, the jobs data are really discouraging at the moment. We thought they would be. They may have been worse than what we thought they would be. The economic data for some time are going to be somewhat uncertain, and it's going to be hard to know what to do. What does an investor do in that circumstance?
You have to sort of keep focused on the long term versus the little blips we're seeing. Obviously, the jobless claims will get worse than better, closer to 20 million by the time we're done, and then start plateauing. I think the way we're looking at it as investors is the numbers will get worse. What we're concerned about is that in the U.S., the transition to coming back in terms of a full functioning economy may take much longer. What we've seen in Asia, and we keep on comparing to Asia, it's a very different situation. In North Asia in particular, you saw people had the masks, there were thermometers available to check people's temperatures, you had the PPEs in a very different way than we have them today. So the economies have started going back. You've seen the schools in Korea, schools in Singapore, in Taiwan, pretty much stayed open throughout the whole situation. A lot of their businesses stayed open because they had these equipment and the testing in the way they did it. In the U.S., given how far behind we are and we're still catching up, I think what we haven't thought about is that transition period is going to be longer. So if you're an investor, really you have to look beyond the next few months and look longer term.
That was Wall Street Week contributor Afsaneh Beschloss. Coming up, we turn to two other Wall Street Week contributors, Larry Summers, former Treasury Secretary, and Glenn Hubbard, former chief economist at the White House, to try to get them to sort out yet another difficult week in the markets. This is Wall Street Week on Bloomberg. Welcome back to Bloomberg Wall Street Week. I'm David Westin. We got our first coronavirus jobs numbers this week, and they were not pretty. We knew they were going to be bad. They were even worse than we expected. And the answer from the vice president to that question about what they're going to do about that was all that money, $350 billion being loaned to small businesses. Well, the question is that going to be enough? And we asked that of Glenn Hubbard. He's a Wall Street Week contributor. Of course, he's from Columbia Business School. He was the chief economist under George W. Bush. And this is what Glenn Hubbard had to say.
Well, it's possible that the Fed can assist, but actually most of this is going to be on the taxpayers' back because, remember, these loans are really grants as long as small and mid-sized firms don't lay off their workers. So I think Congress will have to augment that support in future bills. But frankly, the Treasury Department and the SBA are going to have to redouble their efforts right now to make the program work for banks and borrowers. They're not where they should be.
That's Glenn Hubbard of the Columbia Business School. And now we welcome our special Wall Street Week contributor. He's Larry Summers, former Treasury Secretary. He also was the chief economist under President Obama. Larry, I apologize if I'm hesitating. I'm hearing myself in my ear. But Larry, whether $350 billion is enough or not, you have to get it to people first. What assurance do we have that that will get to people quickly?
There are a lot of people working very hard, and we'll have to see what happens. My suspicion is that Glenn's fear that we're going to need more money very quickly is not going to materialize because the pipes are going to be sufficiently clogged that whatever the principles, money won't flow that fast. But certainly it's going to be very important for the economy to stand this program up as effectively as we can. And look, that's going to require that the government provide the banks with clarity. It's going to require that the government set strong expectations for the banks. But it's also going to require that the government make clear that there aren't going to be any big-scale recriminations afterwards, because you don't move hundreds of billions of dollars to small businesses in periods of a month or two without there being some misappropriation, malappropriation of funds. That's something we probably have to accept as a country in order to stabilize the situation, but the government's going to have to make clear that it's going to bear that.
Larry, do we have any sense at all of how much we could reduce some of that unemployment if we got the money out today?
I don't think we're going to eliminate the largest part of the unemployment. People are not flying on airplanes. Therefore, employed workers at airplanes need to be on furlough. We may be able to make more of it be furlough and less of it be permanent layoff, and that'll help the economy come back when the time comes for the economy to come back. We may be able to keep purchasing power a bit better fortified, and that'll help when the economy comes back. But the basic reason why we have so many people unemployed is that people can't shop and people can't actually function in their workplaces. And there's some jobs, I'm fortunate to have one, that you can do working at home, but the best estimates are that only about a third of us have jobs that you can do at home. And most of the other people have jobs working in stores or jobs working in dentists' offices or jobs working in entertainment places or jobs working in restaurants or jobs working in factories where you can't do the job from home. And you can call it furlough, you can call it short hours, you can call it unemployment, but it's the basic physical reality of the medical situation that's controlling here.
So, Larry, certainly the jobs numbers were very striking for all of us this week. What other news struck you particularly that we should be paying attention to?
The thing that scared me most wasn't actually the job numbers, bad as they were. We know that unemployment's going way, way up, and the bad job number just reflected how much of that had already happened in the survey week in March. The thing that troubled me was the growing signs out of Asia, particularly Singapore, that places that thought they had brought this under control with social isolation, who had enjoyed substantial stretches with essentially no new cases, were starting to see outbreaks of new cases, and having relaxed measures, were having to put back quite substantial control measures. And that raises the question of whether we're going to be doing an accordion on this thing for quite some time to come, where we take the pressure, social control pressure off, and then the disease recurs, and then we put the social pressure back, and it undermines the effectiveness. It makes the case that we really need to be prepared to stay the course and not to do this current phase in an incomplete way, because if we do, we're just going to be back doing it again and again.
Well, and Larry, when you talk about Singapore, that is a developed and relatively wealthy economy, actually. What is this going to do when it really hits Latin America, when it really hits sub-Saharan Africa, some of the less developed countries around the world?
You're seeing catastrophic pictures now out of Ecuador, and we will see them come. I mean, frankly, we're looking at a lot of pictures and a lot of reports that make New York City seem like it's a developing country. And if we're seeing developing country conditions, shortages of masks, not enough ventilators, crowded people pounding on windows trying to get into medical facilities, in New York, I shudder to think what we're going to be seeing over the next several months in Africa or in India or in Latin America. And it's coming at a moment when the leading countries in the world, countries like the United States, are not going to be in a position to provide assistance in the way they normally would because of the magnitude of our challenges. And it's coming at a time when I fear that at least the expansionist elements within China are going to see an opportunity to gain goodwill and influence, and maybe even more than that. So finding a way, even as we're fighting the war at home, to be cooperating with our allies, with the other countries in the G20, with the international institutions, to provide support for the developing world is something I think we have to keep our eye on, even with everything else that's going on.
And Larry, finally and briefly, have we seen the high water point of privatization as effectively, because the governments are really taking over the economy around the world?
I think that the Reagan-Thatcher tide is going out. You're not going to hear any political figure say for a long time after this that government is the problem, not the solution. You're going to see an emphasis on stronger, better governments and the importance of performing basic public functions, of maintaining strength of our community. I think that things were moving very much that way in the United States, certainly, and certainly in a number of places in Europe. But this is going to very much accelerate that by demonstrating very clearly that the only way we're going to get a vaccine is out of government. The only way we're going to get rules that are going to keep us safe from others in our community who are contagious is governmental action. And so I think people are going to think about governments in a different way in the aftermath of this.
Right, right. And may that vaccine come quickly. Thank you so much to Larry Summers, our Wall Street Week contributor of Harvard and former Treasury Secretary. That does it for Wall Street Week for this week. Another week full of coronavirus and our coming to terms with it. Whatever happens this coming week, join us here on Wall Street Week. See you next week.